And let's shift to our sixth presentation this evening, which is entitled A Community. Oh, right, another community. Okay, a community-based vaccine outreach team initiative to increase COVID-19 vaccination rates in Milwaukee. Very similar title to our last one. I had to double check my notes. I was like, am I reading the same one again? And this is going to be led by Val Moore. I will pass the baton over to you, Val.
I think our presentation is actually going to start with Dr. DeBishop, and then I will take my portion to provide.
Oh, Dr. DeBishop is up again. Okay, go ahead.
Yes, thank you so much. Oh, man. Yeah, so we continued at the School of Pharmacy our collaboration with Nextdoor throughout the year, to help educate the community and increase vaccination rates. This project is a little bit different. This is a community-based vaccine outreach team, which aimed to increase COVID-19 vaccination rates in the communities that we served. And as Dr. Ruffalo introduced, I'm joined by Val Moore, our co-presenter, who is the operations supervisor, and he was the leader of the outreach team at Nextdoor. I'll briefly discuss the rationale. As was previously presented this hour, of course, Milwaukee's COVID-19 vaccination rates, as shown by our Department of Health statistics for Black residents, have been significantly lower throughout the pandemic and remain lower than other racial and ethnic groups for whom we have some data. And so we wanted to collaborate again with Nextdoor to facilitate this outreach team model with the stated goal of increasing vaccination rates in the communities that Nextdoor serves. We're grateful to Nextdoor for this partnership. I will mention that Nextdoor did receive a grant to fund this project from the Department of Health Services and their COVID-19 vaccination community outreach grant that was effective this summer, June through August. All right, and I will turn it over to Val.
All right, so we'll start by telling you a little bit about how we went about putting together the team and the work that we did in the community. It all started with a vision by asking the question of what this is going to look like. We came together. I developed a team consisting of 5 dynamic superstars who shared my vision. That's Jeremy, Yee, Aretha, Natasha, and David. And we all had to come together with a plan. We decided that we would establish new and build upon existing relationships that we already have in the community. We went out and canvassed neighborhoods. We hosted community cafes. We had curbside conversations, even sitting on porches, basically just listening, a lot of listening to some of the fears, some of the myths. We worked to dispel those myths and those conversations. And a lot of times we had to even validate some fears when it was appropriate. We shared a lot of information, the most updated information that we received through our trainings at MCW that you just learned about in our previous presentation. Working in partnership with MCW, we also were able to create user-friendly literature. So from there, we began to create opportunities for people to receive the vaccine. So our COVID-19 outreach team hosted community vaccine clinics. One of our partners was with Epistles of Christ Church. We went out into the community and worked with Epistles of Christ to be able to host vaccine clinics at their church and also on their parking lot, hosting a huge summer activity there. We also hosted vaccine clinics at both of our Nextdoor Foundation sites at Capitol, which is the Midtown area, and also here on 29th Street. And within the 3-month grant period, our team provided outreach to over 500 families. We also provided over 250 vaccinations to the targeted underserved community that we engage with. So all of this was done in partnership with Hyatt Pharmacy, the Milwaukee Health Department, and also, of course, with MCW. Is there any questions?
Thank you so much, Val. Val and I would be happy to entertain any questions.
Perfect. Great. Thank you for that. And I put in the chat, this is just such a great example of community academic collaboration at its finest. So kudos to everyone. We have a question coming. I think we have time for one question coming from Dr. Nelson. So he asks, how important is it to connect with culture of the community to support the health of the community?
I think Val should speak to that since she was connecting with the community, and I think she can speak quite well to that question. Val?
I would be happy.
Uh-oh.
Okay, I'd be happy to answer that question, and I really apologize. I'm short-staffed, so I'm at our reception desk. I didn't hear the question because it's pickup time. So if I could please just get the question again, I would be more.
You bet, Val. You're doing great. You're doing great. So the question is, how important is it to connect the culture of the community in order to support the health of the community?
Well, it's absolutely imperative, which is why my team consisted of what our community looks like. Mm-hmm. So we have a young Black man, we have a middle-aged Black man, we have a younger female Black woman, we had a Asian American, and then we also had myself, of course, and I don't know where you want to put me. I people, but anyway, so it's very important to reflect the community. And I will tell you that one of the barriers that we ran into, even though Nextdoor has 10 community partnerships throughout the city of Milwaukee, we have 1, 2, 3 on the south side that serve the Latinx community, and it was very difficult because we didn't look like them. So being able to reach out to them, even though our literature was in their language, even though they were dual language speakers, but that's not enough. So that's why culture is so very important. And I always stress that culture is very important when you're trying to especially come out and talk about something that is as huge as the COVID vaccine, talking about health, talking about, such an important decision that needs to be made. So culture is imperative. We did very well with our Asian community, with people of Hmong heritage, people of Burmese heritage, and people of what is the third one? I can't even think of it. It's listed on our slide presentation. And we vaccinated over 100 of our numbers, over 100 of the families within those cultures, because we had a representative of the culture. We had a representative of the African-American culture, but we didn't have a representative of the Latin community. So we did not get as many. We did have some who were both parents, employees also, who received the vaccine. But to answer that question, culture is imperative.
Yeah, that's the perfect response. Thank you so much for that, Val. And I think all of us on this call think you're a rock star for being with us while you're maintaining a really busy schedule. So thank you for that.